You're listening to Clinical Connections, the Zeph Center podcast that connects you to the latest clinical topics. Welcome back. My name is Courtney Burrow, and I currently serve as the Senior Director of Crisis Innovation and Community Support at Zeph Center. I'm excited to be hosting today's episode as we take an in-depth look at the intersection between law enforcement and mental health services in our community. For this conversation, we're joined by Lieutenant Kelli Russell, Commander of the Toledo Police Community Services Section. Founded in 2014, this team responds to some of the most complex calls in our city, many of which involve mental health challenges. In this episode, we'll explore the training officers receive, the resources available to individuals and families, and how police and crisis professionals work together to keep our community safe. Whether you're curious about what happens behind the scenes during a police response or want to learn more about local support systems, this episode will give you insight into the tools, collaboration, and care that make a difference every day. Let's get into it. Thank you so much for joining us today. Would you please introduce yourself to our listeners and tell us a bit about your current role?
Absolutely. My name is Kelli Russell, and I'm the Lieutenant of Community Services for the Toledo Police Department. I'm also the Crisis Intervention Team Coordinator.
And can you explain the role of the Toledo Police Community Services Section?
Community Services works alongside community members, organizations, businesses, different schools in the area to enhance the quality of life. Toledo Neighborhood Block Watch is the main component of the community services police officers assigned. That actually is getting a new look through the City of Toledo Neighborhood Engagement Committee. They sent out a survey to residents that was voluntary, and right now it's in the step with the undergrads at the University of Toledo to work on a new look of what the Neighborhood Block Watch program is going to look like.
Nice. What types of situations or calls would you say your team most often respond to?
We respond to all types of calls because if you think about different calls that come into the 911 dispatch, pretty much everybody is in some kind of crisis mode. If the caller asks for a CIT officer, which stands for Crisis Intervention Team, we ask for volunteers that are CIT trained to respond to those type of calls. The type of calls concerning a specific mental health issue is usually labeled a check safety call. And looking at the last 4 years, we had over 85,000 calls that were labeled check safety. So the need for CIT officers is very great in the city of Toledo.
How many CIT trained officers are there in Toledo Police?
So we have 236 CIT officers out of the 608 sworn officers that we have. I serve as the CIT coordinator for the police department. So anytime that trainings come up, I will offer that training. And then that usually comes up twice a year that the mental health board will put on. So there is approximately 8 that go into each training. So about 16 officers is what we get every year that can be certified as CIT.
And what kind of specialized training does CIT offer for the officers?
CIT officers have specialized training designed for law enforcement to improve safety and mental health service connections. It covers psychiatric disorders, de-escalation, legal issues, and empathy training. Different organizations come and present their programs, such as NAMI. Judges will come, prosecutors, public defenders, Zeph. Different recovery services will come to present what they have to offer as resources to community members that are in crisis. They also do some role playing too, which is pretty cool, their last day. So they get to see kind of real life situations and get to practice what they learned for the week on that last day of training, which we can see if they've actually digested the curriculum and are able to apply it out in the field.
That sounds very cool and like something that we want a lot of our officers to participate in. How is it different than what all the officers get when they go through the police academy?
So in the police academy, they actually do get about 3 days of training that the OPATA, which is Ohio Police Officers Training Curriculum, actually requires every police officer to get. So the 40-hour CIT training is specialized training. So it's a little bit different and more hands-on than what the academy will give them, and it's absolutely needed. Like in 2025, just last year, we saw over 2,000 police reports come in that were marked as CIT that should probably have some case management or follow-up to those people in the community that have some kind of police interaction with behavioral health issues. So that's, looking at the last 4 years, that's a 30% increase of what the police have seen in past years. So the need is definitely there to have more CIT officers available.
It's nice to be able to identify the need and to also see the number of officers able to respond effectively increasing for your department as well, with the ability to get more of them trained in CIT specific interventions. When your officers, or any officers, arrive on a scene that involves a mental health concern, what approaches do they have available to them, or what tools might they rely on to help them navigate a situation?
The officers have many tools available to them when they respond to different mental health calls. First and foremost, they need to slow down the situation. Often when we get on calls, people are elevated emotions. They're yelling, they're screaming, and we have a hard time understanding exactly what is going on. So if we can have that calm manner when we pull in, we have to be calm ourselves, right? So if the police officer is in crisis, we can help others that are in crisis. So that's first and foremost, is to reduce the urgency of the situation, take a step back, take a deep breath, and try to get everyone to calm down and see what is going on. It starts with active listening. Show empathy by listening, repeat what the person's saying so we understand what they're saying, right? Because we can't go in with what we believe the perspective of the problem is. We have to understand what their perspective is. Setting aside judgment and biases and not trying to fix the situation. Sometimes it's just listening. And oftentimes that's all they really want, is for someone to listen to them and believe the person when they're telling the story and what experiences they are feeling. Often some of the delusions that are going on and some of the calls that we're going on, it's actually happening to that person, right? So we can't argue that, we don't see the person that you see standing through that wall, but to them, that person is really there. So the de-escalation skills that we learn in that CIT training that I mentioned come into effect on these type of calls. Staying calm, quiet, have a low-pitched voice, using open-ended questions, trying to get the person to articulate exactly what's going on. And for officer safety, it's maintaining that safe distance, right? A lot of these people that are in crisis don't want you to come real close to them because they might have some paranoia involved, creating the space to avoid immediate confrontation using non-threatening body language. You don't want to have your hand by your gun, for example. You just want to be there as a person listening and hopefully de-escalate the situation. Another tool we have is the ability to reach out to your team, the mobile crisis team. And we often do that. We have dispatch call to see if your team is available to come out. Often people in a crisis, won't talk to the police, but they'll talk to somebody wearing civilian clothes, someone that's not there as a command presence, that is authoritarian figure. They might respond better to someone that, is a civilian and that has a background in training in behavioral health issues specifically.
And I think that's an important thing for us to touch on today, is the collaboration between our local crisis team and the officers that respond to these situations. Like you said, oftentimes the officers are doing the same things that a clinician may come and do, offer active listening, empathy, trying to understand what the problem might be. I think the officers have a few tools in terms of community supports that they have available. Not everything is available 24/7 the way that crisis services is, and that really helps the person in crisis and the officers to understand some of the other services that might be available to people that are in crisis by having that collaboration. How do the police officers and the crisis professionals work together during the call if they respond to something simultaneously?
Well, I just want to put out there that when the mobile response team does come and join us on a call, first and foremost, it remains the scene of the law enforcement on scene just because of the safety and security of all parties involved. And your mobile crisis response team understands that. They get there, they wait, usually in their car, wait for the police officer to approach, explain the situation. We do not bring anybody onto the scene without making sure safety is first and foremost for everybody. The clinician leads the behavioral health assessment. Once we release that to the clinician on the scene, again, we just make sure everybody's safe and secure, and we let the dialogue continue. Sometimes it takes 5 minutes. Sometimes it could take an hour, really, to get the person in crisis to trust either us or the clinician that arrives on scene to assist us. Again, every situation is unique. Every person in crisis might take a good rapport with the person that arrives, or it may not work. So then it has to go back to the law enforcement, and we need to do what we have to do to get the person ultimately to the care that he or she deserves.
Yeah, I think that's an important thing to remember, that police officers do work really hard to ensure safety, not only of the person in crisis, but also to maintain safety of a scene while somebody in crisis is collaborating with a clinician and being able to share their story in a safe space. We know that a lot of times crises happen not necessarily in the safety of somebody's home, but out on a bus station, street corner, where there are also other people wandering around that might be interested in what is happening as well. For the collaboration between police and the crisis team, can you share an example of a situation where that made a positive difference? So
the Uptown Green Park, approximately a year or two ago, was a site where many homeless individuals that had some behavioral health issues, some addiction issues, were taking up residency in the park. We received a complaint from Engage Toledo to the police department to go and basically see what we could do, enforcement action, to try to make it more welcoming for families. We were tasked with trying to get their assessment of what their needs may be. And instead of going in there in a law enforcement presence, before we even embarked on the problem, we did call for a behavioral health team to accompany us to the park. There was open drinking going on, loud music. They didn't have anywhere to take care of their needs. And so it made it a very difficult situation because it was a public park. We did get agitators on scene. But when we had the clinician there explaining, hey, I'm here too. I'm offering different avenues to look at addiction services, behavioral health needs. I'm looking at ways to address their daily living. Like, how can I make their lives better so they're not living out here in the park? In addition to having her there offering those services, and then we were able to find a local community member across the street that was able to hold on to their belongings while we were able to clean up the park. Though it did take a good 24 hours, we were very successful at that. We wanted to make it a community effort to get the park in an environment that invited families to use the park also. Another situation, we had a gentleman that was in a group home and he wasn't taking care of his needs. The behavioral health agency wanted to do an emergency commitment, but unfortunately he wasn't willing to go, and he was going to put up a fight. He was laying in his bed for up to 10 days and not using the bathroom. So obviously he didn't have the insight to understand that his actions were harming his safety and also the safety of those living in the group home. So they did summons the police to the home. I did respond to that. And again, it was building that trust with the gentleman in the room. It took a good hour of speaking to him, telling him he couldn't lay there, that no matter what he said or did, he had to go. So we did get to the hospital to get his needs met at that time. So that it was a collaboration between the police department and the behavioral health team that was on scene. And they obviously appreciated our help because they knew he needed to go, but your hands are tied. We can help with that. But again, we don't want to fight somebody either, because it's not a law enforcement per se kind of call. It's a behavioral health call, but we're the only ones that have the means to force him to go. So as long as we see that issue with the pink slip, that he lacks the insight, that we also see that, we can assist behavioral health clinicians in what they're seeing in the field to get those that need emergency commitment to a hospital safe and sound.
I think there is a lot of community members, family members, and people that work to try to understand voluntary and involuntary placement in the hospital. It can get very difficult on a lot of different planes for us as the clinicians, for you guys as law enforcement, to try to get somebody to that correct level of care if they're not at the point where we feel that they don't have the right to make that next best choice. And there are a lot of optics around law enforcement and their roles in many different areas. What do you think is the best way that you have found to navigate challenges of criticism for ways that police respond in certain situations?
Often we have to go to 911 calls that are dispatched that involve a mental health challenge just to make sure the scene is safe. Often if the scene is safe, we do try call a mobile response team to take over the scene and connect the person to appropriate services. Often mental health calls are not many officers' favorite type of call, but we have to go to the calls that we're dispatched to, and we have to take them one at a time and navigate those challenges that often come, and hopefully the mobile response unit's available to accompany us on some of these calls that need some intervention.
From your perspective, how do you think community members can proactively access support before a situation escalates to a 911 call?
So there's many resources available to community members besides 911. We often refer people to ZEF's mobile crisis line, 419-904-CARE. There's tons of substance abuse resources out there, behavioral health services, Lucas County Warm Line, if it's just somebody that wants to just talk. There's NAMI of Greater Toledo, Local Help Now, which is the Lucas County Mental Health Board and Substance Abuse website. They also have an app that has all the resources available. 211 is also a gateway into different behavioral health and substance abuse resources. They can help you find anything that you may need. Homelessness issues also. We often get a lot of calls of a homeless individual or someone sleeping in a tent. Those all can be referred into 211, and they actually patch to NPI and PATH, who also has a mobile response team, who will go out to the homeless encampment groups and see what the needs are and get them started on a line so they can have the resources and navigate to finally get housing. So there's a lot of calls that go into 911 that actually can be redirected to the ones that I've mentioned to try to give a break to the 85,000 number that I mentioned earlier over the 4 years. That 85,000 is our number one call for service. Next is burglary alarms. So it top ranks everything everything that police respond to is check safety, which more times than not is someone in crisis.
And in some areas, in other states, they do have a 911 dispatch center that is able to dispatch out some of those other community partners that you were talking about. That's not something that we have currently in Lucas County. So this is good information for people to have, because maybe they don't know that when they call 911, the only responses they can get are law enforcement, fire, and EMS. There isn't another option through 911 that would dispatch those people out. So those other resources that you mentioned have to be called individually prior to something that escalates to the point of needing safety and medical attention on scene.
Yes, unfortunately, we don't have that ability yet. Hopefully in the future. I know Columbus does the Right Response Now unit inside their dispatch center, where when people call 911, they can navigate those calls and triage them to the appropriate response instead of taking crews out of service, going to these calls that can be diverted to, the homeless group, or to someone that may need a warm line that just needs someone to talk to. We're taking police officers out of service to go to these calls when they could be going to burglaries, robberies, shootings. So it's very important to get the message out there that there's other avenues than 911. But we understand that when someone's in crisis, sometimes all they can remember is 911.
It also has been a good experience for me to be able to see some of the breaking down of walls between our systems in terms of reaching out to each other, even if it is a problem for somebody who's struggling with homelessness. Maybe it is linked back to a mental health or substance use concern, and the complaint has come through Engage Toledo or through code compliance, to be able to work in tandem with law enforcement, with PATH, with a mental health agency, to follow up on some of those things and see those people be successful in treatment somewhere to get help, has been a really great experience for me in terms of watching people who previously didn't have as many opportunities or were frequently encountering law enforcement but not really encountering any other resources, be able to access a lot more services has been really good. What gives you hope about the future of police and mental health collaboration in Toledo?
I am seeing directly the success that we often didn't see before with the constant collaboration. I know we had an individual, her name was Linda. She was living out of her car, and she was an older lady, but unfortunately she was being scammed of her money, being promised another home. And I went and visited her multiple times, again, trying to build that trust. And it was cold. It was a cold winter. It was when I first went to community services in 2022. And I didn't know what to do because I was brand new and I had just become the CIT coordinator. So I didn't have the connections that I have now. And I know I reached out to COPE, the Coalition Organization to Protect Elders, because I also serve on that committee. And I didn't even know where to start. And PATH came out and actually was able to get Linda to go in and get some help. So that gave me hope. Like, you see them out living in their car, and you just got to stay in those connections, those collaborations, to make sure that they have an advocate and that they have the connections to these different entities that can help them out and make sure they're getting the resources they need for successful living.
And many of the people that we work with or that we serve in mental health and addiction treatment don't have a lot of family support or positive family support. It is more difficult for them to move through different things in life, if depending on what they have been shown, what they've learned, what they know. We do have people that we interact with who do have family members advocating for them. And I often think that the only thing harder than having mental illness is watching somebody that you love struggle with mental illness. We get a lot of calls from family members for individuals who need help but don't necessarily see that yet and aren't at a place where we can force them into treatment. So I think that the collaboration that we've established, where if 911 is called and police or fire respond, having a mental health clinician, sometimes even just to follow up with the family to give them resources if we aren't in a position to be able to get the individual that they're hoping into services yet. And like you said, establishing that rapport. If it isn't the mental health clinician that can do that, sometimes it is the law enforcement officer that responds often enough that they become a familiar face and the person is open finally to treatment, that they will get them to it when that time happens. So I have been fortunate enough to see that happen as well in terms of success stories that we've been able to witness.
I just want to mention that NAMI of Greater Toledo often gets a hold of me because we have families that know their loved ones maybe are living in a condemned home. So that is a safety concern. So police do respond to those that Sarah's like, hey, can you check on a gentleman that's living in a condemned home? The family's really worried. Can you convince him on getting help? Not always do we convince him or her to get help, but we try. We try to make the weekly visits, just do check-ins, making sure you're okay. And that's another thing I wanted to mention. We do check-ins on elderly. We have the RSVP, the retired seniors patrol that can go out to elderly that maybe have dementia that aren't really into a long-term facility yet, but they're living alone and families are worried about them. So we do have the RSVP program that patrolmen, a lot of actually the volunteers are retired patrolmen that go out and check on the elderly. So that does give the relief for regular patrol on the street. We assign that to our RSVP unit so they can go out and check on the elderly individuals out there struggling with some mental health issues also. So that's a good tool that we have. A lot of the individuals out there in crisis do have family, but a lot do not. I just kind of wanted to touch on that too, is the lack of guardians in the city of Toledo is definitely an eye-opener for the community to see. There's not enough guardians to go around. I'm in constant conversations with the Guardianship Services Board. They do have spots for developmentally delayed individuals, but when it comes to individuals that are in that category, trying to get a guardian that we so desperately need in the city is something that we need to creatively come up with a solution as a community to get more advocates for those that are struggling out there.
I think that's a good point about creatively figuring out different ways to handle certain areas of improvement that we see in the community. I know that you and I have been working with some other agencies on the idea that we might be able to implement a start of a unit within the city that is able to respond to mental health calls with a behavioral health clinician and a law enforcement officer at the same time, instead of what we've been mentioning, which is law enforcement responds and then calls for the secondary mental health clinician, as well as hopefully some of that follow-up that you were talking about law enforcement doing, having the ability to have a social services worker available to do those things. I am hopeful that that will help the city in more ways than one. What would be your message about the idea of that unit and how you feel from a law enforcement perspective about that potential?
I think a lot of law enforcement in the country are going that route, putting a clinician, behavioral health therapist in the car along with a law enforcement officer. And we have to adapt to change, right? It's something new. It's something that's another tool. So per the chief, he's willing to explore that different option. So I know we are working at maybe implementing a co-responder unit, and I'm very hopeful that it comes to fruition, that we can get the clinician out in the field. Not only would it help the person in crisis, I think it would help the different officers that have the opportunity to ride with the clinician to be educated and reminded. I mean, there is so many resources in Lucas County, and sometimes we lose track of how many because we don't deal with them every day, where the clinician can remind us, hey, this is available or this is available. Let's try this. Let's try that. I think it's a great opportunity for the police department to look at that tool, because that's really what it is. It's an extra avenue to come up with a solution to all these 911 calls. We can't be going in the same route we've been going for the eternity of the police department. We have to be creative. We have to come up with new solutions. I mean, I mentioned that, calls have increased 30% in the last 4 years. We have to come up with different ideas. And I think the co-responder unit is a solution to try to get a handle on these calls. And a lot of these calls are high utilizers, right? So we go and we take calls and we take calls and we take calls, some of them up to 20 times within a couple weeks. We're at their home because it's a cyclical event and we can't break that cycle. So we got to come up with something new. And I'm excited for that possible partnership, that collaboration that, Courtney, you probably get 20 emails from me every couple weeks. Like, hey, can you follow up with this person? Could you imagine if you were in the car with me, you could do that follow up right then and there. And that person's not waiting and have to call 911 again and again. So I think it's a solution to decrease our 911 call volume of the amount of check safeties that we go to.
And I like what you mentioned about it brings something to the law enforcement officer in terms of education and also support. A lot of what law enforcement responds to outside of these mental health calls is hard, difficult material, topics, behaviors, and having somebody that is within the fold of what you're doing and understands those things makes it a little bit easier to talk through some of the things that are seen and in a safe space. So aside from just resources, I think that's another dual thing that a clinician could bring to a department.
And that plays on officer wellness, right? So we build that trust with that clinician in the car, that relationship, what's bothering us as a law enforcement officer, because if we're not well, we can't help those out in the community. And everybody knows that we all struggle with different events that you see on the news that involve a law enforcement. And it's tragic because we don't have that relationship often that we need with a clinician or therapist to talk about our problems. And, I'm first to admit that we have problems in our police department, and there are several officers that need some help, and to trust a clinician in a car might be the first step. Maybe they've never talked to a therapist and might be their first step to their officer wellness.
Yes, I'm looking forward to the opportunity to be able to show all the law enforcement officers how cool therapists are. So, if there is any one message that you wanted the community to walk away with about your work, what would it be?
We are genuinely invested in the success of accessible mental health, substance abuse treatment, and are dedicated at working nonstop to foster the relationship that we've built over the last couple of years we've been working together. And we're first to say we can't do it alone.
I think that's a great note for us to end on. It's been great talking with you, Kelli. Thanks so much for taking the time to come in and chat about all of this with us. I appreciate it so much.
Thank you, Courtney, for having me. And it's been a pleasure to really share what the Toledo Police Department sees on a daily basis and giving me the voice to share what complications we often see and that there's avenues out there to connect people for help.
Thank you so much to Lieutenant Kelli Russell for joining us and showcasing the important work her team does in our community. We hope today's conversation gives you a better understanding of how police and crisis teams work together and inspires confidence that our community has professionals ready to help you when it's needed most. If you or someone you know is facing a mental health crisis, there are resources available. Locally, you can call Crisis Care at 419-904-2273, or nationally, you can call or text 988. Remember, reaching out for help is a sign of strength, and support is always available. If you enjoyed this conversation, be sure to download and share this episode. For the latest clinical connections, subscribe on Spotify, Apple Podcasts, or wherever your favorite podcasts are found. For more information about Zeph Center's crisis care services and other resources mentioned in this episode, check out our show notes. For more information on Zeph Center, visit us at zephcenter.org or find us on Facebook, Instagram, and LinkedIn. Until next time, this is Courtney Burrow signing off.